Hey, everybody, Dr. Rob Silverman here. I've got superstar in this space. Her motto is midlife should be the bridge to your new life, Linda Stevens. I love that motto.
Thank you. I think it's pretty good too.
I love it. I love it. I love it. So how'd you get into this health and wellness space?
I got into this health and wellness space as a reinvention of myself, if you will. My first life, I like to say, I worked on Wall Street. I went to college for business, finance, economics, and I worked on Wall Street for years. I worked at Smith Barney. I worked at Dean Witter. I'm probably dating myself. I ended up finishing up at UBS, and I got pregnant with my son. So I was going to go back to work. And then after sort of visiting some daycare centers and talking to some people to come in and take care of my not born yet child, I realized I couldn't put my precious something in somebody else's hands. So I decided to step away from that life and stay home and be a stay-at-home mom. And doing that, I had my daughter 2 years later, but a friend of mine ran corporate gyms in the Stamford, Connecticut area, which is where I am in Fairfield County. And she said, you like to work out, which I loved to work out. I always lifted weights and did cardiovascular. And she's like, why don't you get your certification, PT, and come and work for me and teach some classes? So I did that. And then when I started doing that, people started asking me to train them. And they started asking me to help them lose weight. So I decided to go back to school. I went to the University of Bridgeport, like yourself, right? You went, and I did the weekend program for 2 years. And it was great because I had little kids. My husband was like, I got the kids, you go Saturday and Sunday all day. And that's what I did, and took some prereqs first so I could get in, and got my master's degree in nutrition. And then I really turned my business towards helping people lose weight. And then over the years, it's just evolved into, working with different business coaches saying, hey, and listening to business coaches, you need to find a niche. You really need to hone in on one thing, like we were just saying before. Find one thing that you're really good at. You don't need to do everything under the nutrition umbrella. You don't need to know every single thing. So, obviously, I do know a lot, but he's like, focus on one thing. And as I got into my 40s, I look back now, I'm 55, and I didn't know anything about hormones. No one ever told me to test my hormones in my blood. I had no clue. I felt great. I was strong. I was healthy. I was a competitor. But now that I'm in my mid 50s, and I'm going through perimenopause, I just did all my hormone blood work, and it tells you this whole story. So my mission now is to get women in maybe their late 30s, early 40s, and say, hey, look, we need to get a baseline. We need to understand what's going on. Let's look at your hormone levels. I get the questions of, why can't I lose weight? Why is I hardly eat anything and my midsection is changing, or I can't sleep. My libido is terrible. I'm having hot flashes, night sweats. I forget things. I'm anxious. All the symptoms that come with hormonal imbalances and life changing. So I decided to really turn my business that way and focus on that midlife. I say midlife woman because it's really, it's the age bracket is really 40 and over, and it can go well into the 60s. So being a midlife woman myself, I'm using myself as a guinea pig because I'm testing my hormones. I'm understanding what it means and all those things, so I can bring it all together. So when I get a woman who comes to me and says those things, I'm like, okay, let's do this. Let's check your hormones, which you're a doctor, and it's very interesting because, and you probably get this in your practice, I'll say to women, tell your GP, your OBGYN, whatever, let's test your progesterone, estrogen, testosterone, free test, thyroid. And the doctors tell them, oh, it's not necessary. We don't need to do that. It's, I hear lots of excuses why they don't want to do the blood work for their patients. So it's been very enlightening. So I've really developed a whole little protocol now where I can get them the script. They can go to Quest or whatever their lab is and get the blood work done. And then we can look at it and figure out what next steps need to be taken, if any.
That's great. And I think the blood work takes the guessing out. So we've talked about this many times about the idea of testing, not guessing. And I'm choosing my words carefully. That's why I paused. My wife said an age where she's going through those changes, and I have a lot of patients going through those changes. And like you said, many years ago, it was deemed an excuse, and it was horrible. It's just not fair. And just so you know, men go through the changes also.
Right.
But that estrogen change, I mean, I've called it before, estrogen and progesterone are without question evil twins, if you will.
Right.
They're really tough. But it's interesting, your plight, because you did something that I really like. You put together your Midlife Mastery program. What's that all about? Could you explain that?
So Midlife Mastery is something I developed. It's a 6-week virtual course. So it's online. It's through Zoom. It's a once a week presentation with me. I slot an hour time, and I present on a few different topics over those 6 weeks. I go through a protocol for a woman who's over 40, 50 and beyond, is what I say, because so many women fit into the midlife time frame. And I've developed the program so that we talk about what should your nutrition look like at this point in midlife, because it's going to be very different than when we were in our 20s and 30s. And like you said before, we rebound really quickly in our 20s and 30s. You could go out. I remember going out with my friends, drinking, hanging out, going to bed at 2 a.m, but getting up the next day and being able to function pretty quickly. Whereas if I did anything like that now, it'd probably take me a few days. I can't even really stay up past like 9:30, 10 o'clock anyways. But I go through nutrition for a woman now in midlife, talk about different supplementation, things that are important for us in midlife that we should be doing, like knowing your vitamin D levels and other things, probiotics, gut health. I go through what your sleep should be like now in midlife. I do a whole segment on hormones and talking about estrogen, progesterone, testosterone, free tests, thyroid, all our different hormones and how they change, how we absorb protein. So I really try to give them in 6 weeks a really good, comprehensive, easy to understand picture of what's happening to them and things that they can do, lifestyle modifications that they can implement. Maybe it's not drinking wine every night anymore, or eating differently, less processed foods. I mean, people just really don't take good care of themselves. And it's unfortunate that a lot of people will say, I need to have a couple glasses of wine every night to take the edge off. So now it's kind of showing them, okay, well, this is what you're doing to your body. This is what you're doing to your liver. Your liver's got to stop detoxing the estrogen that's circulating in your system to detox your blood. And now your estrogen's piling up. And then that can cause certain health issues if you're drinking consistently. What about breast cancer? Now, 1 to 2 drinks has been shown to increase your risk of breast cancer, or other types of cancers in women. So I want to give them easy to understand, not overwhelm them, but so many women, Dr. Silverman, don't understand what's going on in this time period. They have no clue. They don't know why they sit down now and they can't button their pants anymore, or their midsection's hanging over their waistband, or, they don't eat. They're like, well, I hardly ever eat. Why am I gaining weight? Well, that's a problem. You're storing more body fat by starving yourself and then eating your face off at 9 o'clock at night because you're starving. So, and just teaching them in that 6 weeks how to manage what's happening to them.
That's a great program. I mean, 6 weeks is a good period of time because you're giving them enough time to change habits.
Yes.
And, get comfortable in a new setting. You had a really salient point in that estrogen gets detoxed in the liver. Most people don't realize that, because I ask a lot of my patients, where does that extra estrogen go? Why are you not getting rid of your estrogen? It goes back to a systematic effect of the inability to detox. So some supplements that are great to detox would be sulforaphane.
Right.
Some other ones like L-glutathione. So people should really look at detox as an ancillary process that everybody should partake in. Now, I'm going to flick the switch and say, if you can't detox estrogen and you're a male, it's going to drive your testosterone down also. So even though I know you're specializing in women's issues, detoxification is a human issue, if you will. So kudos for you for bringing that up. I did want to ask you a question.
Yes.
Why women over 40 have such a harder time losing weight than when they're in 20s and 30s? Because 40 is not old, 50 is not old, 40 is the new 25.
Right. No.
But yet chronically they complain about this. How do you address it?
Chronically, they complain about it. And most times, in my experience, is women just they don't eat enough. And they'll say, I hear a lot like, well, I had one egg for breakfast. I had an egg for breakfast and a piece of toast. I'm like, all right, well, that's good, but egg has what, 6 grams of protein in it. So and then they won't eat all day. And then they'll go out and have to a restaurant and eat a meal that's, very high in fat or has a lot of salt in it, eat a lot of sugar. They eat sporadically. So now they're starting to store more body fat because their metabolism is